Families do seek help when they know they have cancer, heart disease, or diabetes, and how it affects the family. They receive appropriate treatment, but they don't do that for drugs. Because they see it as, well, it's as, in addition to being illegal, it's a sort of shameful type of thing, I would imagine. Let's talk about what happens when a family is feeling shame, as we just mentioned, due to a family member's substance abuse disorder. We see that all the time. Yeah. It's any experience. I know, Lynn, you've had experience with families. And what's the name of the group? Learn to Cope? Learn to Cope support group,
Brings
yes.
these families together, and it was just such a wonderful organization.
Right.
And before that, they really had nowhere to go, did they?
Right. Well, there was some groups like Al-Anon and groups like that, but it's very difficult for people to seek help because it is so, addiction is so stigmatized.
Yes.
So what was really nice was that Joanne Peterson, who's been on this show before,
yes.
She was able to reach out to other families through actually, I believe she started like a little
website
online,
emails,
yeah,
yes.
And then people were able to contact her. I mean, I think the first time she put something in the paper and left an email address. I think over a couple of days she got like 90 responses. So she did find that there were a lot of
yes.
other people out there that were going through similar situations. So it's really good that families can get together, and I think that's what we've been trying to do here in Weymouth. Is I know in 2008 when you took office, there were quite a few families that
yes.
came to see you. And that's when you came to us in the substance abuse prevention team and said, hey, what's going on here?
Right away.
And
something going on.
Yeah, and so I think it was really important not to just fight the crime, but it was also important to get help for the families that needed help and support. So we do highly recommend that people get involved in a support group because it is a family disease. It's not just the person who's using drugs. It affects the entire family.
There is a national survey, and the results showed the stigma as one of the main reasons people do not seek help.
Correct.
Excuse me, only 10% actually seek specialty care. And internationally, drug addiction is the #1 most stigmatized condition. Mm-hmm. My goodness. Now, are they dealing with opiate abuse internationally?
Oh yeah,
yeah,
yeah. All around the world, wherever there's opiates, there's addiction to them. Yeah.
And I've said many times, the scary thing about opiates is that they're legally dispensed. And so there's no cutting them off and saying, okay, go away. And that whole, what was the drug they produced for cancer patients?
The OxyContin.
OxyContin, and then that's what it was for. And I don't think that they worried about addiction because the fatality rate was high. They thought, okay, if you're going to be high, at least you're going to be in a pleasant state. If you're gonna fade away,
pain,
yes, yeah, it gets rid of the pain.
It was the pain, and it got into the wrong hands.
And that's why I'm so fearful about medical marijuana, because sure, it may help some people, but the abuse factor is huge.
Think about the direct-to-consumer marketing with all of these medications. It's really difficult to identify what is in fact a threat because patients can come in and talk to their doctors and say, I want to try this. And there's a lot of pressure on providers to take aggressive, I think, steps in treating pain and treating illness. And we are a lot more educated. We have WebMD. We have a lot of resources as lay people, but maybe not the full understanding of what may or may not happen through taking those medications.
So if I'm someone who would easily be addicted, would I show signs? I'm trying to help families, think about helping families and how they can identify these things. And I know it's different with every individual.
Well, I think that in terms of families, I think of if I'm mom and say my dad had problems with alcohol, that could be a factor, a genetic factor in my family. So I really have to be concerned and really educate my children about that. So I think that you can see that there is predisposition in families.
Is it fair to say if there's predisposition with alcohol, they more than likely would be with drugs? Or are they very different?
I don't know, Dr. Kelly, do you?
There are common risk factors which can produce. There is evidence to suggest that there is a propensity towards addiction generally, and then there are also specific genes, for example, with alcohol in particular, that we know, and alcohol's been the thing that's been most studied because that's the highest prevalence, and there's lots of people to study, there are certain genes that are specific to the risk, in terms of metabolism for alcohol, for example. But there are certain, kind of common factors whereby you can have a family history of alcoholism and then be more likely to at increased risk for develop addiction, not just to alcohol, but a different drug, depending on exposure. So what's available in the environment, whether, what age do you get exposed to it? All these things are factors which influence it. Psychiatric, as I mentioned, impulsivity, attention problems, sensation seeking, novelty seeking. These are kinds of personality factors which also increase the risk. So if you've got a particularly, sensation seeking kid who is impulsive, who has attention problems, who has trouble following direction, all these things, those factors would be a risk factor. That doesn't mean that they're destined to become addicted to a substance,
but it would be
they
easier.
increase the risk incrementally. Yes. So all these factors combine. Because these are preventable disorders, there's much that we can do to try and influence and intervene earlier through better education, less exposure to drugs that are legal, higher prices, less availability. All these things we know are evidence-based policies which can reduce harm. For example, for alcohol, if marijuana becomes more legalized, there are things that will need to be done to stem the public health impact of that, because there's going to be an increase, as I mentioned. You increase the availability of a drug, you make it legal, you're going to drop the price. The price is going to drop substantially. That's one of the consequences of that. That means more people are going to have access to it, more people are going to be able to afford it and use it. And to the extent that it causes harm, and we know that marijuana can cause addiction, it can cause intoxication, and therefore it can cause accidents, we're going to see an increase in public harm. So all these things, all these factors are going to need to be thought through, which I don't think they have been adequately thought through in all cases, to deal with other drugs that may become legalized or decriminalized.
Let's talk about recovery. Where are we? Are we in the curve? Are we doing as much as we can?
Well, we know that one of the things that's important and what we've really come to understand more and more about addiction is that it's best treated as a chronic condition. I think what we've done historically is talked about it as a chronic condition, but treated it still as an acute condition. So we think somebody going into rehab for 30 days that should constitute a cure. And that we have high expectations that people are going to come out of that 30-day experience as if they were in there to mend a broken leg, and they're going to come out and then be in recovery for the rest of their life. No, that's not the model for a chronic illness. The chronic illness model is more like hypertension, more like diabetes, more like asthma, the way that you would treat any other chronic medical condition. Now, addiction to substances actually fits that model very well. And people who are engaged in long-term treatment, pharmacological treatment, psychosocial treatment, mutual help groups like AA and NA in the community, get involved in those things, they're the ones that tend to do better because it's a better fit for the chronic relapsing course of addiction. What we know is that even when people become addicted, when they first meet criteria for addiction, it can take several years before they start to seek help themselves. Now, part of that is just, stigma and shame about it. Part of it is just I need to try and control it, I need to cut down, I need to stop, I need to do this, and they'll try all kinds of different kinds of things before they eventually say, you know what, I can't do this by myself. Now, it may be that they get intervened upon earlier because they get in trouble with the criminal justice system. So that can be an earlier pathway into treatment, actually, which can be a good thing for many people. For other people, that might not happen, but they'll try attempts at self-regulation, at quitting, cutting down, stopping, unsuccessfully. And that can take several years. Then they start seeking help, formal help. So they get into a treatment program, or they go to a mutual help group, and they start getting access to care, right? Now, even after they start that, and this is where the chronic part comes in, is that it can take up to 8 years after that first contact with a formal specialty care program to get 1 year of full remission, to get 1 year of abstinence and full remission, on average, again. Amazing. So half, an average can be misleading. So in other words, half the people are getting into recovery much sooner than that, half longer. But But that's a long time, right, before. Now, as people are going along, in other words, there's a bumpy road to recovery. The good news is most people actually achieve full sustained remission. It can take a while to get there. About 60% of people who meet criteria for alcohol, opiate, cocaine, whatever drug, about 60% on average will achieve full sustained remission.
I think that's fabulous. I didn't think those numbers were always that good.
Yeah, yeah.
It's good, that's great.
And I think part of the problem is, and why people have had a kind of a pessimistic, nihilistic view of it, is because we're kind of conditioned to these reports in the media of only the bad stuff that happens when, as you mentioned, the headline news, so-and-so has come out of treatment and relapse.
Yes.
Or been arrested, when you've got 25 million people in the United States who are in long-term recovery. So that's a lot of people, and we know now that the most likely outcome actually for people with addiction is actually remission and recovery.
I see.
That's the most likely outcome. The challenging bit is working towards that, because people can have it can be a bumpy ride. As people get some recovery and remission time and then they relapse. They get a little bit more. And as people go along, they learn what they can and cannot do. I can't hang around with those people if I'm going to be serious about staying sober. I can't go here if I'm serious about staying sober. I've learned that. People do learn that the hard way typically.
Yep.
As they bump along, bump forwards. And the good news is if people hang in there and they get the help that they need and they continue it, families can be very important, and families can lose hope too. And this is where groups like Learn to Cope can be very helpful, because they can help families take the 30,000-foot view. That, your daughter or son or a loved one went into treatment. Yes, they may have relapsed, but don't give up. Don't give up, because it can take a long time for people to get full sustained remission.
And oftentimes the child is a young adult and beyond the age, so parents really don't have a say over them. They don't have a legal jurisdiction over them. And yet I ran into a couple I knew years ago, told me they had to sell their house because they had an addicted daughter. They were trying to get her, into recovery. And they're going to go bankrupt. And this is, daughter's, I think, in the late 20s. So it's not always the young kids that you have more of a say over. So that's really tough.
It's so important to frame, I think, recovery as a process, because I think part of that stigma is thinking, oh, well, you went through treatment, so you should be fine, and you failed. You're not able to succeed, when really there's a beautiful story that I think of someone walking down a road and falling into a hole. They didn't see the hole coming, and they fell in. It took them a while to pull themselves out. The next day, the day after, they walk down the street, they know the hole's coming, and they keep falling in, and it takes even longer to pull themselves out the next time. But eventually, they walk down the street, and they see the hole, and they're able to walk around it. And the day after that, they walk down a different street. And when I think about it, it really gives, I think, hope to families that it may not be immediate, but that there is hope in the future, too.
Yes, by all means. Dr. Kelly, how can you relate what we've talked about today to the prescription drug and heroin epidemic across the whole country?
Well, as I mentioned, I think one of the issues.
Get into the prescribing.
I think one of the issues has been, again, you've got to be have exposure to the substance in order for, even if you had the predisposition for those two things to meet, because the combination of the environment and exposure to the drug and your genetic and biological makeup.
And not to interrupt, because I am actually, but the likelihood of everyone experiencing prescription for drug, not for drug, for pain, is everybody's going to get them, right? At some point in their life, somebody's going to get a pain prescription. So,
and as I mentioned, it's not everybody who will become addicted, because there are different. Inside of each of us, there are different risks for different diseases, right? Whether it's heart disease or cancer, or we can suffer from, including addiction.
Yes.
And certain people are more vulnerable to addiction than others. So you have to be careful. You have to be careful with alcohol. You have to be careful with opiates if they're prescribed. And the thing is like anything, there are instructions for use of medications, right? So if you follow the instructions correctly, there shouldn't be a problem, right, if you're following the instructions. One of the problems is that people don't follow the instructions. They may misuse them. They may take more than is prescribed to obtain the side effects. right? Which is the euphoria, the positive. They want to get high. Other people. So a good idea with any kind of medication, especially if you feel that you might be vulnerable to, liking it too much, is to have someone else monitor the medication. That's a very good strategy. So if you live with someone, let them know before you get out of the hospital, or if you have a prescription on an outpatient basis, is to just let them know, I'm taking this medication, I'm a bit worried about it. People do this in recovery all the time, right? Is that, say if you're in recovery and you have to take an opiate, right, the pain is going to be so severe that you really need to. So people do this by really, preparing for that, after they had the surgery or the operational procedure, by getting all these people in the network ready for this thing that they're going to have to do, to monitor the medication and to really, so you really prepare for the risks ahead. And people do that a lot in recovery, for example.
And I think that's good practice to begin with anyway. When you talk about young kids getting medications, kids are being prescribed medicines for hyperactivity, and if you have your wisdom teeth out as a young person, I think it's always a good thing. I always say to parents when they ask me what can I do, keep control of that bottle. Don't let the child have control of that bottle. That's going to be so key, because you'll be more apt to follow the instructions rather than the child. And kids know that some of these, at an early age, they know that these medications, what they're capable of and how much money they can make from them.
Yes.
And get them out of the house.
And get them out of the house when you don't use them.
Use prescription drug take back and the kiosk here in the police department. I think I was one of the kids with the wisdom teeth and the Vicodin, and I certainly never used it, illicitly or wrongly, but there's so much of it now. It was an abnormality, I think, when I was a little younger too. So I think there's more, and just getting out of the house is a huge protective factor.
So we do have a kiosk, a medication collection kiosk at the police station, and it's available 24 hours a day, 7 days a week for people to get rid of those kinds of medicines that are, put people at risk. And we also have medication collection take-back days. We'll actually have one this October 26th.
We do 3 total, don't we?
We usually do 4. We usually do 4 a year, and sometimes we even do more. We go to senior housing developments and collect medications from seniors. But the National Drug Take Back Day this in 2013 in the fall is October 26th, and we were able to schedule our household hazardous waste collection day the same day. So we'll be collecting medicines at that time.
We have a big take, don't we?
Yeah, we usually collect quite a few.
Quite a line out there.
Quite a line, yes, there is.
So people, I think, on the whole, they want to get rid of them.
And if you're in line, I just want to say this, if you're in line at Household Hazardous Waste Collection Days and all you have is medication, we will let you in. You don't have to wait out in the big...
You can line jump.
Yes, you can line jump, and we'll make sure that that'll happen.
Sure. Thanks, Lynn. Jessica, let's talk about prevention. What is prevention?
Well, that's a great question. So I like to think about prevention as an active process, which is a little strange because we're thinking about preventing something or stopping something from happening, but an active process of creating the community conditions and the personal attributes that promote well-being. So in the context of substance abuse, we're trying to create the right conditions that help us avoid the cost to a community of people doing drugs, the real tangible, concrete costs of people in treatment and recovery, the cost to the economy, but also the less easy to measure costs to families and to the individuals that are suffering with addiction themselves.
Sure.
I like to think of prevention in a story form. It makes more sense to me, of a river and a bridge. So if you picture people crossing a bridge over a river, there are some that are going to fall through these planks of the bridge and develop a substance use disorder. And they fall into the river and they're being swept downstream. And there are these amazing professionals along the banks of the river, people who are working in the detoxes, the treatment programs, recovery specialists, medical professionals, helping these people in the river pull themselves out of the river and get back, on track. We prevention folks are at the same river doing the same type of work, but we're over at the bridge trying to figure out why there are people falling through and if there's anything we can do to fix the planks so people aren't falling into the river. We're all there. I think of prevention in terms of being on that spectrum with treatment and recovery as well.
Sure, very well put. Are we spending enough Obviously, we're not. But it's not just a state issue. We know it's not just a local issue. Certainly a state issue. They haven't been able to conquer it. It's a federal issue. They haven't been able to.
The return on
harness it.
investment in prevention is huge, and I think something that we prevention types have to work on is quantifying it. I think that economic dollar arguments are really impactful, and we actually have a lot of data that says if you prevent young people from smoking cigarettes, you prevent all of this illness later in life, all of this addiction, all of this hardship, and we can do a better job, I think, as prevention people making that known, because there are economic benefits to it, and there's not enough money going to prevention.
Shouldn't we spend more time talking about what it costs to handle the addicted through recovery and whatever, as opposed to what it would cost to hype up prevention?
I think it's all important.
Hey, that's what A&F wants to hear. It's all about the dollar.
It's exactly right. I agree, and I think the argument needs to be made. And prevention is very effective. I mean, we see evidence of that here in Weymouth all the time. The work of the substance abuse prevention team. We're collecting the data that says I'm blessed to be able to work with Lynn on this team, and we've collected youth data for the last 6 years that have shown us that alcohol use is going down steadily. Tobacco, cigarette use has gone down. Students that report using prescription drugs currently within the last 30 days has gone down. We'll have new survey